Have you ever brushed off a nagging feeling, a little ache, or a persistent tiredness, telling yourself, "Oh, it's just part of getting older"? We've all been there. It's so easy to attribute new sensations to the natural process of aging, to dismiss them as minor inconveniences. But here's a painful truth that many of us, especially after turning 60, need to hear loud and clear sometimes. Those seemingly innocent, almost strange symptoms aren't just age. They can be quiet, urgent whispers from your heart, signaling it might be struggling more than you realize. It's a secret that our bodies try to tell us, but we often don't speak the language. Ignoring these subtle signs can lead to bigger problems down the road. And nobody wants that. Your heart is an incredible engine that's been working tirelessly for decades, and it deserves your attention and care, now more than ever. In this video, we're going to dive deep into 6 strange, often overlooked symptoms that can reveal your heart is in trouble after 60. These aren't the dramatic, chest-clutching heart attack signs you see in movies, but rather the quiet, persistent nudges that can easily be mistaken for something else entirely. We'll explore what these symptoms feel like, why they occur, and most importantly, why you should never, ever ignore them. Understanding these subtle warnings could be one of the most important things you do for your well-being. So, settle in, because what you learn today could truly change your life. And make sure to watch all the way to the end, because I've got something for you that will truly surprise you. Let's begin with the first symptom that often catches people by surprise: a persistent and unusual fatigue. Now, I know what you might be thinking. Who isn't tired after 60? And you're absolutely right. A certain level of tiredness is normal as we age, but this isn't your everyday. I didn't sleep well last night, kind of tired. Or, I worked hard in the garden today, kind of tired. This is a profound, overwhelming exhaustion that doesn't go away. Even after a good night's rest, imagine feeling utterly drained after simple, routine tasks that you used to do with ease: showering, getting dressed, walking to the mailbox. It's a bone-deep weariness that makes even the thought of daily activities feel like climbing a mountain. You might find yourself canceling plans, needing frequent naps, or just feeling wiped out by mid-afternoon for no apparent reason. This kind of fatigue isn't just about feeling sleepy. It's a lack of energy, a sense of being constantly run down. Why would this be a sign of heart trouble? Well, when your heart isn't pumping blood as efficiently as it should, your entire body starts to suffer. Your muscles and organs aren't getting enough oxygen and nutrients, which are vital for energy production. It's like trying to run a car on an almost empty tank. It just won't go far, and it'll sputter and cough along the way. Your heart is working harder and harder just to keep up, and that extra effort depletes your energy reserves. This feeling can be particularly noticeable for women, who might experience this profound fatigue weeks before any more conventional heart attack symptoms appear. It's often dismissed as stress, overwork, or just the natural progression of aging. But if it's new, persistent, and disproportionate to your activity level, it's a red flag waving in the wind. Don't simply shrug it off. Start keeping a little journal of when you feel this fatigue, how severe it is, and what you were doing before it hit. This information can be incredibly helpful for your doctor. Moving on to our second subtle symptom, one that can also be easily missed or attributed to other things: swelling in your ankles, feet, or legs. You might notice your shoes feel tighter than usual, or that your socks leave deep, noticeable indentations around your ankles by the end of the day. This swelling, often called edema, occurs when fluid builds up in your body's tissues. It might feel a bit puffy, and if you press your finger into the swollen area, it might leave a temporary indentation. It's not necessarily painful, which is why it's so easy to ignore or blame on standing too long, hot weather, or just being on your feet all day. However, significant or persistent swelling, especially in both legs, can be a sign that your heart isn't pumping blood effectively. When your heart struggles to pump, Blood can back up in the veins, leading to fluid leaking out of the capillaries and accumulating in the surrounding tissues, especially in the lower extremities due to gravity. This is often a sign of congestive heart failure, where the heart can't keep up with the demands of the body. It's a very common sign. Yet because it's not painful, many people just accept it as a normal part of getting older, perhaps thinking they need new, wider shoes, while some swelling can indeed be benign, if it's a new development, if it's accompanied by that unusual fatigue we just talked about, or if it doesn't resolve after elevating your legs, it's definitely something to bring to your doctor's attention. They can check your heart function and rule out other causes. Simple actions like elevating your legs when resting can provide temporary relief, but it's the underlying cause that truly needs to be addressed. Remember, your body gives you clues. It's up to us to listen and take action when those clues become persistent. Now that we've discussed unusual fatigue and swelling in the lower extremities, let's talk about a third symptom that's often misdiagnosed as something entirely different, a persistent cough or wheezing. You might think, "Oh, it's just my allergies," or "I must have a touch of bronchitis again," or even, "This is just smoker's cough," if that applies to you. But if you have a chronic cough that just won't go away, especially one that produces white or pink-tinged mucus, or if you find yourself wheezing without a clear respiratory illness, your heart might be signaling distress. This cough isn't usually the hacking, chest-rattling kind you get with a cold. It's often a dry, persistent tickle, or a moist cough that feels like there's always something in your throat, particularly when you lie down to sleep. This happens because a struggling heart can lead to a buildup of fluid in the lungs, a condition known as pulmonary edema. The fluid irritates the airways, triggering a cough or a wheezing sound as air tries to pass through narrowed passages. It's crucial to understand that while a cough can be caused by countless things, allergies, colds, flu, asthma, or even certain medications, if it's accompanied by any of the other symptoms we're discussing today, or if it seems to worsen when you lie flat, it becomes a much more serious consideration for your heart. Many people will try over-the-counter cough medicines or dismiss it as just another bug, losing precious time when early intervention could make a significant difference. Pay attention to the timing of the cough. Does it get worse at night? Does it wake you up? Do you feel short of breath when you have these coughing spells? These are important details to share with your healthcare provider. Your lungs and heart are intimately connected, and what affects one can certainly affect the other. This isn't about scaring you, but empowering you with knowledge so you can advocate for your health and recognize when something more profound might be going on beneath the surface of a simple cough. Next up, a fourth symptom that many people would never associate with their heart: a significant loss of appetite or feelings of nausea. This might seem completely unrelated, as we typically associate digestive issues with the stomach or intestines. But if you find yourself feeling full after just a few bites, or if you have a persistent queasy feeling or even outright nausea without an obvious cause like food poisoning or a stomach virus, it could be your heart sending a distress signal. You might start losing weight unintentionally because you simply don't feel like eating, or the thought of food makes you feel sick. This can be especially concerning if it's a new and unexplained change for you. So, how does your heart connect to your stomach when your heart isn't pumping blood effectively? Two main things can happen that lead to these digestive symptoms. First, fluid can back up into the liver and intestines, causing swelling and discomfort in your abdominal area. This swelling can press on your stomach, making you feel full quickly and uncomfortably, or even nauseated. Second, a struggling heart might not be sending enough blood to your digestive system. When your digestive organs don't receive an adequate blood supply, they can't function properly, leading to a general feeling of malaise, indigestion, and a lack of appetite. It's a chain reaction, and the body's delicate balance gets disrupted. Many individuals, especially those over 60, might attribute this to just aging, or side effects from other medications, or even stress. They might try antacids or change their diet. But if the underlying issue is the heart, these remedies won't fix the problem. If you notice a sudden and persistent aversion to food, or unexplained nausea that doesn't resolve quickly, and particularly if it's combined with any of the other symptoms we've discussed, it's a sign that warrants a serious conversation with your doctor. Your body is a complex system, and sometimes symptoms show up in unexpected places to tell you something important. Don't let these unusual digestive complaints go unchecked, especially when they persist over time. Now, let's talk about the fifth sign. One that often surprises people because it doesn't fit the typical Hollywood image of a heart problem: pain that radiates to unexpected places like the arm, back, neck, jaw, or even the stomach. We're all familiar with the classic image of someone clutching their chest, but heart pain, especially in women, can manifest very differently. It might not be a sharp, intense chest pain at all. Instead, it could be a dull ache, a pressure, or a strange discomfort that you can't quite pinpoint. Imagine a persistent ache in your jaw that you attribute to dental problems, or a strange tightness in your back or shoulders that feels like a muscle strain but doesn't get better with rest or massage. It could be a discomfort in your arm, often the left one, but it can also be the right. That feels more like a heavy, numb sensation than a sharp pain, or even stomach pain, a burning sensation, or a feeling of indigestion that lingers, which gets mistaken for heartburn. This phenomenon is called referred pain. Your heart shares nerve pathways with other parts of your body, and when there's an issue with the heart, your brain sometimes interprets the pain signals as coming from these other areas. This is particularly common in women, who are more likely to experience these atypical symptoms during a heart attack or other cardiac event. They might describe it as a sense of unease, a general malaise, or a feeling of being unwell, rather than specific pain. Because these symptoms are so varied and can mimic other conditions like arthritis, pulled muscles, or indigestion, they are frequently dismissed or misdiagnosed. It's absolutely critical to pay attention to new, persistent, or worsening pain or discomfort in these areas, especially if it occurs with exertion, even mild, and resolves with rest, or if it's accompanied by that unusual fatigue, shortness of breath, or sweating. Don't hesitate to seek medical attention, even if you think it's just something else. It's always better to be safe than sorry when your heart is involved. Finally, let's discuss our sixth symptom: lightheadedness or dizziness. Again, this is something that can be easily attributed to many benign factors: dehydration, standing up too quickly, or even just feeling a bit off from a cold. And sometimes, it is just those things. But if you find yourself experiencing frequent bouts of lightheadedness, a persistent feeling of unsteadiness, or brief moments where you feel like you might faint, it could be a sign that your heart isn't pumping enough blood to your brain. Your brain needs a consistent and adequate supply of oxygen-rich blood to function properly. And if that supply is interrupted or insufficient, dizziness or lightheadedness can be the first warning sign. This can happen if your heart rate is too slow, too fast, or if it's simply too weak to pump blood efficiently throughout your body. You might experience this feeling when you stand up from a sitting or lying position, or even while you're just going about your day. It might be a momentary head rush, or it could be a more sustained sensation of wooziness. This can lead to falls, which are a serious concern for anyone over 60, often resulting in injuries that significantly impact quality of life. While it's important to ensure you're staying hydrated and managing any blood pressure medications correctly, if these episodes of dizziness or lightheadedness become more frequent, more severe, or if they are accompanied by chest discomfort, shortness of breath, or that unusual fatigue we discussed, it's a critical sign not to ignore. Your brain is giving you a clear signal that something isn't quite right with its blood supply. And in many cases, the heart is at the root of that problem. Listening to these signals and discussing them with your doctor can lead to timely diagnosis and treatment. which can prevent more serious events down the line. Remember, every symptom is a piece of the puzzle your body is trying to solve for you. So, we've explored 6 surprising symptoms that your heart might be trying to tell you about its health after 60. That profound, unexplained fatigue that lingers, the persistent swelling in your ankles or legs, a cough or wheezing that just won't quit, an unexplained loss of appetite or nausea, pain that radiates to your arm, back, neck, jaw, or stomach, and those unsettling spells of lightheadedness or dizziness. These aren't just minor inconveniences to dismiss with an, "Oh, it's just my age." They are vital messages, subtle at first, but growing clearer as your body tries to communicate with you. Your heart is resilient, but it also needs your proactive care and attention, especially as the years go by. Understanding these signals empowers you to take control, to ask the right questions, and to seek the right care. Remember, small changes and early detection can make an immense difference to your health and happiness. You have the power to influence your well-being, and it starts with listening to your body and taking its whispers seriously. Don't hesitate to talk to your doctor about any of these symptoms. Even if they seem minor on their own, they can help put the pieces together and ensure your heart is getting the care it needs. Your health journey is a partnership between you and your healthcare team, and being informed is your greatest asset. We're all in this together, supporting each other to live our fullest, healthiest lives. Please share your thoughts or experiences in the comments below. Your insights could help someone else who's going through something similar. And if you found this information helpful, please give this video a thumbs up and subscribe to our channel for more valuable content designed to help you thrive at every age. Keep learning, keep listening to your body, and keep advocating for yourself. Live your best life at every age.